Since we last met last week, the numbers provided, I think during last week's session, we had achieved, I think, 55 visits at that point. Since then, we have had, since last Tuesday, 19 separate investigations into COVID-like illnesses or COVID confirmed cases. And if my calculus is correct, 4 of those had confirmed cases that were involved and required further quarantining. And a good portion of those are actually ongoing now, and information that we're bringing in right now to further inform the contact investigation process. But based upon my numbers, since we last talked in our last briefing, on last Wednesday, there have been 19 different investigations launched, and 4 of those, the majority of those were COVID-like illnesses that have been ruled out with further testing, but at least in 4 of those cases, they have involved cases involving students, staff, and or teachers. To transition in terms to what is safe in terms of moving forward, we've been very clear that we think and support the notion, or I think I support the notion, that in order to be effective and to move forward, we should see lower levels of community transmission. Now, the state guidelines that have been provided to us from MDH, the State Department of Education, as well as informed by the most recently submitted disseminated guidelines from the CDC, break numbers down in community transmission by your test positivity and your cases per 100,000 residents. And so if we look at the state guidelines, we have achieved a test positivity lower than 5%. We have not achieved a cases per 100,000 rate that is below 5 per 100,000. And so we still sit in a range where, for the state guidelines, we would not be able to open back up fully. Schools would be able to open up in the sense of some type of hybrid model. And so, non-public schools are looking at what that means further, as well as the public schools are looking at their provisions to see if it's possible to be able to offer some opportunities for small group sessions to come back. We have continued to provide guidance to both non-public and public schools and are looking to discover, explore, and to support best practices that have been associated with schools reopening not only in our jurisdiction, but across the state and the region, as well as across the country. And so we continue to look at advice, for example, in terms of how do you integrate and incorporate regular routine testing as a part of strategies to bring teachers, students, and staff back. And we will continue to work with both our partners in the non-public setting and public school setting to provide that guidance so that whatever decision is made and whatever model is selected in terms of bringing students back, we will be able to provide the most up-to-date guidelines to keep the students and staff safe.